Dear students, in this class we will study about the toxicokinetic, the importance of toxicokinetic and their use in day-to-day life. Why the toxicokinetic is useful in our life and why it is useful for human health. The toxicokinetic deals with the study of the toxins and their mechanisms of actions in human beings. And as the word is toxicokinetic is right from the two words, first is toxic, second is kinetic. It means the movement of toxins, movement of poison in our body, and the items we are eating, we are having in the form of treatment, in the form of daily use, whether they are causing any side effects or harmful effects to us or not. For this lecture is dedicated to understand the mechanisms of actions of toxicokinetic or toxic. Let's take what is toxin. Any small quantity or a large quantity that is intended for human use or animal use, but can cause some harmful effects into the body or our cells. Thus, we can define a toxin is any substance that even in a small quantities or a very ultra low concentrations after a single administration or repeated exposure cause severe damage to or the death of the organism. For this, we can use the Professor Sager. He quoted that any substance qualitatively or quantitatively foreign to the organism that causes chemical or physical damage to the organism should be classified as a toxins. Now, from these definitions, we can understand the what is toxin and what is poison. There are the certain factors responsible for affecting the toxin's effectiveness, and the effectiveness of toxin is known as a toxicity. How much a chemical is toxic, it is known as a toxicity. So, they give the three major principles. First is the concentration, how much concentrations, or in a simpler form, in a therapeutic form, we can say the dose of a toxin or toxic. Next is complexations, third is C competitions. They are the C cube, concentration, complexations and competitions. These are the three principles as per the Sager professors. These are important in deciding the toxicity level of a chemical. The concentrations. The dose or concentration issue has been mentioned above. It is generally true that the higher the dose, the stronger the effect. It means the dose higher is directly proportional to the toxicity effects, but sometimes the phenomena is opposite to this, like less amount of dose, less amount of toxin can exhibit a harmful effects, and this process, this phenomena is known as hormesis. Such substances have this opposite effect in a small doses than in the large doses. Let's take an example. We most frequently come across the so-called radiations. Radiation in a very small quantity, in a small concentration, in a small range, they are very protective for us, and we use these radiations for the protective mechanism. Like X-ray radiations are used in day-to-day life. Ultrasound we use some kind of radiations, and UV, some kind of UV radiations are also used for protective mechanism for cleaning purposes. And let's take an example of a chemical, the methylene blue. It's used as a reduction agent in the cases of nitrogen poisoning. But higher concentration of nitrogen may cause methemoglobinemia at higher concentration. It means when there is a high concentrations of methylene blue, it may cause ischemia to our body, may lead to the increase the palpitations, and lack of oxygen may occur that lead to the asthma to our body. Basically, the concentration of a drug, of a toxin is matter. The second is the competitions. Competition between the solutions molecules when there are a large number of molecules are available in the body system, in the cells, in a single cells, when large number of ions are present, so their sensitivity to the receptors is increased. So, the cells can receptors can bind to different molecules at a single time and may increase the toxicity. Apart from it, complexometric. Complexometry is the for when there is a increased number of ions, there is a decrease of statistic force. It means reduce the electrostatic force. When there is a decrease electrostatic force, it means there is an increase of attractive forces. When there is attractive forces, the van der Waals force will be dominating. When the van der Waals force will be dominating, it means a larger complex will form and coagulation will form. This result to the formations of complexometric reactions and lead to the high toxicity. There are the certain objective while studying the toxicity. Depending on our projects, depending on the subjects, whether intended to the human use or for external use. Sometimes toxicity is also checked for the external purposes, like for the radiations, for mobile phones, for any other that is used by the humans or the animals. The first primary objective of toxicity is to describe the systemic exposure achieved in animals and its relation to the dose levels. The how much exposure is given to the animal, so that this we can find out some relationship between the dose level and the toxicity level. And of course the durations, the three important part. First is the species of the animals and the dose levels and the durations of the study. These three important are important parameters while studying the toxicity. There are certain secondary objectives to relate the exposure achieved in the toxicity studies to toxicological findings. How the expose to animals or particular toxins is responsible for the toxicological findings and contribute to the assessment of the relevance of these findings to clinical safety. And these data used to support the choice of species, like we are using mouse, rat, rabbit, monkey and other, and choosing the right species essentials for conducting the toxicity studies. For example, when we are studying the vomiting studies, and as we all aware that the mouse and rats have did not have any CTZ center, chemo trigger zone centers, that is responsible for vomiting centers. So we cannot choose our mouse as a model for conducting the CTZ for vomiting center studies. And treatment regime in non-clinical studies. Last is to provide the information which in conjunction with the toxicity findings contribute to design of the subsequent non-clinical toxicity studies. Some examples of how toxicokinetics of a substance can influence in its toxicity. First is the absorptions. A highly toxic substance that is purely absorbed. It means we are having a large dose into our body, but it is not absorbed by the small intestines. It is not digested by our liver. It is not metabolized by our liver. It means when the drug is not metabolized, it not absorbing in a high concentration or low concentration, it does not make a high toxic effect to our body. So the absorptions become a limiting factor for toxic effects. Next is biotransformation. Let's biotransformation. Biotransformation is derived from the two words, the bio and transformations. When there is a change or alterations in the chemical structures or the chemical moiety within the cells, this is known as a biotransformation. Biotransformation is also known as a metabolism of the product or metabolism of the drug, metabolism of the toxic or metabolism of the toxins. Two substances with equal toxicity and absorptions may define how hazardous they are depending on the nature of their biotransformation. For example, if a substance that is biotransformed into more toxic metabolites is bioactivated, is a greater hazard. A chemical which is taken by an animal, but it is transformed into more toxic compounds by the metabolic enzymes, by the reductions, oxidations or any other chemical reaction within the liver. So they may cause more harm. But on the contrary, there are certain chemicals, they are converted into least toxin materials or detoxified by our liver. So this is the role of the biotransformations and the absorptions into our body. There are three types main toxicity levels: low dose levels, intermediate dose levels, and high dose levels. These three are related to the dose exposure, and this is known as a quantification of exposure. If a person is exposed to low dose levels, so what should be the precautions? How we can avoid? What should be the parameter to avoid the toxicity to the human? First is somebody having a low dose levels. We can use some antiemetics models, use nitrogen mustard and antiemetic agents to cause the vomiting in that particular event. If there is a intermediate dose levels, there is a emergency conditions, we should use some high experts toxicologists for dealing with the intermediate dose levels. If there are the certain high dose levels, when the person is not aware of which kind of toxin is administered to the persons, and the doctor or the toxicologist is not aware about the toxins, so what we will do? The toxicologist and kinetic play important role. Here is the main role of the toxicokinetic. For example, in today's world, we are dealing with the toxins. So first is the absorptions. The toxicokinetic will deal with the exposure. See how much the absorptions of a drug. If the drug is known, let's take an example: ciprofloxacins or methylene blue. Methylene blue is toxic to the human at a high dose, but it is not toxic at a low dose. Someone is ingested high dose of methylene blue. The toxicologist will do the blood parameters. What will do? They will inject the low dose of methylene blue to the animals, and at a time 0. Using blood sampling at various interval times, the 15 minutes interval, 30 minutes, 45 minutes, 1 hour. And in these periods, 1 hour, 24 hours, 3 hours, they are they are withdrawing the blood from the animals. On first exposure, after the administration of a methylene blue, it will reach to the stomach, and after 15 minutes, 30 minutes, 45 minutes, 1 hour reach to the liver. Then the systemic circulation. So when withdrawing the blood at this different level, using this we can segregate the plasma or the serum, and we can estimate the binding capacity of methylene blue with the albumin. For example, in 2 hours, a very low dose of methylene blue is used to the systemic circulations. So we can use that kind of medications to avoid the further absorption of the drug, or we can use some another pathy so that we can avoid the absorption of the methylene blue in the body. That's why the toxicokinetic is important. Apart from it, in mouse models, in animals model, we can perform certain kind of studies versus single dose toxicity. A single dose is administered, and we use this method for evaluations: the toxicity of liver toxicity, kidney toxicity, nephron toxicity, brain toxicity. We can find out the effect of a single dose in animals. If this single dose is not causing a much toxicity to our body, we can extrapolate this data. We can use the repeated dose toxicity studies. In this, we use a multiple doses so that the toxic effects or the toxic dose, lethal dose LD50, can be calculated by this method. There are the two special kinds of toxicity. First is genotoxicity, and next is carcinogenicity. Why these two important to us? Let's take an example of Zintac. Zintac is a very popular drug used by sometimes used by the common people, and the most several pharmacy persons pharmacists are giving. But later on we got to know that ranitidine has some kind of anti-cancer, no sorry, cancer carcinogenic molecule, that is NMDA molecule is found in ranitidine. It become a case study for the toxicologist, and then the whole project and whole medicines of that brand undergone a thorough research. It found that while forming the ranitidine through the chemical process, some of the metabolite is converted to the NMDA, that is a metabolite, and can cause the cancer into the body. That is known as carcinogenicity studies. The genotoxicity are certain drugs, certain molecules after administration they cause a gene modification, gene alterations, and can bring the anomalies to the fetus, can bring the abnormalities to the pregnant ladies. As we all aware about the genotoxicity level of the thalidomide. Thalidomide is used for the morning sickness in 1960s around, and used by pregnant ladies, and it caused a thalidomide disaster. It means the fetus born with joint limbs and feet. Now there is a difference between the difference between the pharmacokinetic and the toxicokinetic. Pharmacokinetic basically deals with only the drugs. After the approval, we only choose the drugs, how the drugs is absorbed in our body, distribution, metabolism, and excretion in the body. It has been with us for many years, as we all aware that the pharmacokinetic we are studying since long, but the toxicokinetic it is a more recent discipline of science. Extensive collaboration with the pharmacology. The uh, pharmacology is studied by the many industrial setup by pharmaceutical companies for to explore the commercial benefit of the products. It all extensive collaboration with the toxicologists, toxicokinetic and pharmacokinetics. It's a collaborative study of three different domains. Lower doses than the toxicokinetic. In pharmacokinetics, generally we use a very low dose as a to check the potency of the drug, potency of the new molecule. But in toxicokinetic, generally we use higher doses so that we can calculate the LD50 or the toxic doses of particular compounds. They are the four processes that are involved in the toxicokinetics as we study in the pharmacokinetics. The toxicokinetics, the first is the absorption, the substance and enter the body and their mechanism, whether it is active absorptions, passive absorptions, carrier mediated or facilitated absorptions, finding the methods of the absorptions. First is the distribution. Now what is distributions? Distributions, let's take an example of a plate that contains a number of fruits and we are sprinkling the salt over it. So, it is uneven distributions of the salt over the fruits. In the similar way, when the drug is absorbed in our body, it reaches to the liver, metabolized by the liver. It is unevenly distributed to the different organs. Why it is distributed unevenly to the different parts? As the susceptibility, as the permeability of each organ varies differently. The permeability of brain cells is protected by three layers, uh, pyometer, arcanide and dura matrix, and the cells of the cardiac, that is the myocardial cells are different. The respiratory is a different cells. The gastrointestinal cells are made up of different cells. It means the permeability differs. That's why the distributions of a drug, distribution of the toxins varies. Some toxins may affect only the liver. Some toxin may affect only kidneys. Some may affect the all over the body. Depending on the chemical nature, whether it is lipophilic or the hydrophilic in nature. That's why the distributions studies essentials for treating the toxic studies, for toxin studies or poison studies. Next is the biotransformations. The transformation of a chemicals that we do in the lab using some oxidation and reduction, that is only a synthesis process. But when the transformation of a molecule of toxin occurs within the body changes. The cells is reacting with the chemicals. They are performing reductions or oxidation or additions any molecule or hydrogenations of the molecules is known as a biotransformation. The substance into the new chemical, generally a new metabolite or a new chemical is formed after the ingestion into the body. Next, after showing its effect, the toxin or the drug profile, it is excreted in different form. Excretions or the elimination, in majority the excretion is done by the kidney, but in certain cases we notice that the some products are excreted either the sweat, the tears, sometimes through the vapors, and sometimes by the breastfeeding mothers also excrete some kind of drugs through the milk. This is the structures how the different role of absorption, distribution, transformation, and animation are interrelated process as illustrated in this figure. We can use the storage, the kidney, lung, how these are affected, and there is a intercellular cells and extracellular process. Using this image, we can identify the intensity of a drug and intensity of a drug, of a poison, of toxic, how it is affecting to each time. Now, let's take more depth into the absorptions. The ability to be observed is essential for systemic toxicity to occur. If there is no absorption of a toxic, it means there is no toxic effect in our body. The first step is crucial while studying the toxins. Some chemicals are readily absorbed and others purely absorbed. So, totally depending on the absorption's power. For example, nearly all alcohols are readily absorbed when ingested. Ethanol and methyl alcohol and ethyl alcohol are easily absorbed. Mostly alcohols are absorbed, but methyl alcohol is more toxic than the ethyl alcohol. Why? Because after ingestions of methyl alcohol is convert into the formic acid, that is very lethal to us. But ethyl alcohol is formed into other form, that's why it is not toxic to us. When there is virtually no absorption for most polymers. The polymer that is complexometric agents, they are magnesium sulfate, calcium products, some calcium binding agents, or some antibiotics with bind with the calcium products are not absorbed into the body. The key factor in quantitative assessment of human health risk from the chemical exposure is the correct quantification of the amount of the chemical substance passing through the biomembrane, that is the skin, thus actually entering the body. After absorption, after entering the body, its absorption is done through the small intestine, through the villi. It depends on the permeability of the skin, permeability of the if we expose to the our skin, it depends on the permeability of the biomembrane of the skin. If it in the body, it depends on the cells and the double layer of the skin, that is the lipophilic and lipid bilayers. So whether it is entering or not, it depends on the lipophilicity and hydrophilicity of the molecule. Without the toxicokinetic study, usually 100% absorption is assumed, and whenever we are planning a study, we are performing our protocols, we assume that 100% absorption is assumed, which may over predict the risk of the systemic toxicity. So, we are considering the when the drug is given, it is causing 100% toxicity, so that we can plan our treatment as per the 100% systemic toxicity. Next is distributions. As already told you that the what is distributions is simply the distribution and the adaptability of a cells to receive the drug. The distribution of toxicants and the toxic metabolites throughout the body ultimately determine the sites where the toxicity occurs. The permeability of particular organs. A major determinant of whether or not a toxicant will damage the cells is its lipid solubility. The lipid solubility is important limiting factor for toxicants and toxic metabolites. If a toxicant is lipid soluble, it readily penetrates the cell membrane. It means those drugs are lipid soluble or lipid molecules are more readily absorbed in the body as compared to hydrophilic in nature drugs. That's why the chemical structures and the solubility of a molecule of a toxicants of a toxic substance is to be determined before the chemical study that comes under the category of physiochemical studies. The distributions become important factors, especially for fat tissues. Liver, kidney, and bone are the most common storage depots. Blood serves as the main avenue for the distributions, and limbs are distributed some materials. Thank you.